everyone, and welcome to the second Assist Community Conversation. Today's topic is when two worlds collide, what happens when you're a mental health professional and a spiritual experiencer as well. Just for those of you that might be joining us today that is not very familiar with ASSIST, ASSIST stands for the American Center for the Integration of Spiritually Transformative Experiences. And our mission is to support people who've had spiritually transformative experiences by providing them a network of support and education. And we do this by having a private forum only for experiencers. And we also have academic conferences every year in which we educate and certify mental health professionals. And Katrina, our executive director, will be sharing a little bit more about that later in today's broadcast. We also provide training for people who want to become a peer support group facilitator and start a support group in your area or online for people who've had spiritually transformative experiences. And if I didn't already say it, my name is Elizabeth Sabet and I am the president. And I'm going to turn this over today to our executive director, Katrina Michelle, who is a holistic psychotherapist practicing in New York City. Katrina?
Thanks, Elizabeth. So glad that we have everybody gathered here today for our second Assist Community Conversation. And I'm really excited about this gathering, in particular because of our topic, which is when two worlds collide, the dilemma of being a spiritual experiencer and a mental health professional. As somebody myself who considers herself a spiritual experiencer, as I think all of us are in some capacity, and a licensed professional, my work and my research has been informed by my experiences. And I think when it comes to sharing that with our clients, we face unique challenges because we're bound by a certain code of ethics and certain expectations in our disciplines. So this is something that keeps coming up. And I think it's a great opportunity to gather with our panel here today, everyone from a different discipline, to talk about what we've experienced in our practices and what we can do to help ourselves manage this and best serve our clients. So thanks for being here with us today. We have Dr. Frank Pasciuti, Dr. Alice Lee, and Edie Nathan. And I'm gonna turn it over to each of you to briefly introduce yourselves, what brings you here, and a little bit about your backgrounds. Dr. Pasciuti, why don't you begin?
Okay, thank you for inviting me to your forum. Yes, I'm a clinical psychologist and licensed certified hypnotherapist, and I work in Charlottesville, Virginia. I've been working here for about 37 years. And actually one of the main reasons I came to Charlottesville was because I was interested in the research that was going on and continues to go on at the University of Virginia's Division of Perceptual Studies. There they study reincarnation, mediumship, near-death experiences, and assorted other paranormal phenomena. My interest in this whole area and the intersection between the anomalous experiences or spiritually transformative experiences and how it intersects with psychotherapy is what actually got me into the field. For me, I've been the beneficiary of receiving a number of referrals over my 37 years, which has enabled me to have a cross-section of clients where I've attempted to try to integrate how I would work with them in psychotherapy at the same time honor the uniqueness of their experiences. I also sit on the board of the Monroe Institute, which is south of Charlottesville, about a half an hour, and have a connection to the folks at the Edgar Cayce Institute out of Virginia Beach, all of whom, including a couple of other meditation groups here in town, refer to me. And so it has been my challenge and over the years, and I've continued to try to formulate in my mind how what I know about typical psychological development and concepts in psychology and how we treat those in psychotherapy interact with the supernormal kinds of experiences that people will often bring in and help allay fears that people have, that sometimes they're crazy or they think that a therapist is going to think they're losing their grounding. and help them understand their experience and normalize it as much as possible, and then help them arrive at what it means for them. Assist seems to be the place to be affiliated with when you have those kinds of questions and are dealing with those kinds of clients.
Yeah, that's great. Thank you. And I'm so grateful that you're a part of our Assist community, Dr. Schutte.
Happy to be here.
Yeah. All right. Let's have Dr. Alice Lee introduce herself. Thanks for being with us.
Thank you for having me. So my background is in child, adolescent, and adult psychiatry. And I started becoming more of a holistic psychiatrist back in 2002, where I began by integrating functional or orthomolecular medicine into my practice. That's the nutritional piece. And then in 2003, I started to integrate more of the energy medicine piece into my practice, starting with the tapping methods, EFT, and other meditations and things like that to help people, mainly to get off their psychiatric medications. So my practice right now specializes in helping people get off their psychotropic medications, and it's very much a psychiatric practice, even though it has a different kind of opposite, goal for my patients than most psychiatrists. In terms of my exploration in terms of energy medicine or some of the spiritual aspects in my practice, I started in 2003 with training in Reiki. So I'm a Reiki master, and so I integrate some of the understanding of energy and our connection to energy in my practice, and I try to teach that to my patients so that they understand that there's a connection between their mind, this energy field, and their physical health and healing. And so because I'm able to integrate the energy medicine piece in a very concrete way for my patients, demonstrating it to them, I think that they're able to add another tool to their toolbox and heal that way. My own personal experiences typically stay out of the psychiatric setting. I'm not there to share my personal experiences with anyone unless their whole orientation in terms of their treatment with me has a lot to do with spiritual experiences. And sometimes I will share some of my experiences to help serve their needs. But my experiences in terms of spiritual experiences began when I was about 13, when in my prayers, I was telling God that I wasn't going to pray to him anymore because I had just had a Sunday school lesson that said that they didn't know what he looked like. So that night I had a very interesting dream in which I met a being of light and was able to have some profound experiences. That was what kind of was one of the most powerful experiences when I was younger. And over the course of my life, I've just found that there were many other experiences that confirm my my connection and a relationship with the spiritual world.
Okay, wow, that's fascinating. Thanks for sharing with us, actually. Okay, so Edie Nathan, thanks for joining us today. Let's unmute your microphone and invite you to introduce yourself and tell us a little bit about your backgrounds.
My name is Edie Nathan, and I have been a psychotherapist for over 20 years, and I integrate psychotherapy and actually the study of the soul in grief into my work. And I have probably had a relationship with death and dying and grief since the moment I popped out of the womb. I don't exactly know why or how that happened, but it just did. And I was always interested in what happens when we grieve, what happens when we die, where do we go? And that exploration, those questions from the time I was really young, actually led me into a journey that was curious, unknown, and continued to get me to
Hang on.
study. So so I use EMDR, which is actually something for people who have experienced a lot of trauma. It's an eye movement that really helps people work with the brain and the cognitions of the brain to work through grief. And I work with hypnosis, and I have trained with Brian Weiss and Hank Wesselman, who is a shaman, and have really taken shamanism to different levels within my practice, through meditation and guided imagery, hypnosis. And I come from a perspective of Carl Jung, that we have a collective unconscious, and that we don't just feel what's going on within our bodies and within our molecules because of our histories today, but that we carry the histories of millenniums, you know, many, many hundreds of years before us. And we characterize those feelings through our anxiety, through our sexual issues. And through that all, I actually ended up being all of my studies, I ended up being the psychotherapist on the show, Psychic Kids, Children of the Paranormal on A&E. And what was so interesting about that experience was that I met children who were definitely seers, who had intuitions. But what we didn't look at was their trauma and the traumas that they had gone through that actually lent their minds, opened their minds to things that are normally hidden, and allowed them to be experiencers. And so I have really been able to see how trauma informs our ability to see, and to see beyond what maybe other people don't see.
Thank you. And that's a big topic in and of itself. We'll have to talk about that at some point.
Absolutely.
Yeah. Thanks, Edie.
Thank you.
Yeah. So this is great. We have a great panel. Everyone has diverse experiences and coming from a slightly different background. And now let's open up the conversation to the community. And we have Diana DeFranco on the phone. And we're going to try this very low tech, so I hope that you can hear her okay. Diana?
I'll try to be loud.
Okay. Can everybody hear Diana? Okay. All right, Diana, why don't you give us a brief introduction of yourself and ask your question?
Sure. Well, you know, my name is, I'm a psychotherapist in private practice here in East Guilford, Connecticut. And I am certified as a professional with assist. And a good percentage of the clients that I see are people who've had some type of spiritually transformative experience. Many of them have had near-death experiences or near-death-like experiences. And they come to me with the purpose of being validated, to have their experience be validated, and also they come to me with the desire to integrate their experience in their lives. And the question, so that's my introduction. I also lead a support group for IANS, Shoreline IANS. And we meet mostly near-death experiencers, but also people who've had spiritually transformative experiences come in and they share their experiences. So that's what I do.
Thank you. And so what's the question that we can pose to our panel today?
Okay. One, I would like to know what their experience is or what they think about this. Several of my clients who come with spiritual experiences, they asked me, needless to say, if I've had an experience myself. And because it's with the purpose of helping them, sometimes, you know, I say yes. So my question is, I find a dilemma in when they ask me if I had, number one, if I had this experience, and yes, I say yes. But when they want to know details of my experience or experiences. And when they ask me that, and also they ask me, how did I integrate my experience? How long did it take me? So it's a dilemma because as much as it could be helpful for the client, it's a dilemma because, needless to say, you don't want to turn the session about you. So that's the question. What do you do in cases like that?
Okay. Thanks, Diana. So let's turn it over to our panel. Does anybody have some thoughts? Would they like to be our first person to respond to that question?
I would be willing to speak to it. If the issue is to what extent you should share or we should share with our clients our own experience, I personally don't have a problem sharing my experiences if the client is looking for validation, to just be assured that, you know, that we have had or I have had an experience so they can feel safer putting theirs out there. I'm fine with doing that, but I'm always sensitive to not taking the stage and having it be about me. I often find that if they get the relief sometimes to hear that a therapist has had an exceptional experience or may not have had their exact experience. And that may not necessarily be the need may not be there. So I would be curious about, as a therapist, do they need for me to have their experience, the same kind of experience? Like, I've never had a near-death experience. I've had other, you know, kinds of experiences. So I would be always wondering a little bit about, you know, it's not like I'm withholding. I'm a very self-disclosing therapist, but I'm always sensitive to the fact that you don't want to take the stage away, or what is it serving that they need for you to confirm that you've had your own experience. So I would treat that in a more conventional manner, even though it's a less conventional topic.
Great. Yeah, thank you.
Thank you so much. And if I may ask, I do share my experience when they ask me to share it, when somehow it's in line with their experience, so they find validation, and sometimes or oftentimes it's very empowering to them, especially when they have been pathologized by someone else, by either another therapist or anybody. It's very empowering. The thing is, when they go into, when they're asking, well, what are the steps that you took personally to integrate your experience? Well, what I try to do is, if it's in line with their own experience, I share that with them. So thank you so much for your response. I think that's
Welcome.
I would also like to add something, which is that I see it as an opportunity. It's an elicitation to find out what's going on for the client. And before I might share my story, I'm going to be curious as to why they want to know what my experience has been, how it will help them, how it will frame them, if they think it will enhance their relationship with me, or is it a way to get close to me? Is it a way for them to feel like they're in partnership, you know, with me? What is the goal that they have in kind of wanting to know this? And it really serves to as a window into what's going on. And sometimes I will say, I'm happy to answer this question, but before I do, let's explore what's going on for you, because sometimes the question takes the heat off of them and onto me. And I don't want to participate in having the heat taken off of them, and then kind of colluding with them and it looks like I'm creating an alliance, but really it's a collusion. So I'm very careful about what I share, especially when it comes to something that is personal around my own experiences.
I'd like to also add that.
Thank you. Thank you so much for your response. That was very thoughtful.
You're welcome.
So I'd also like to add that there's a difference between a patient who asks you about your personal experience versus just asking about experiences in general that they can learn from vicariously. So that difference is maybe what's glaringly sensitive here, because if you were to share your personal experiences, how is that different than, helping a patient by sharing a lot of the knowledge that you have about near-death experiences or any other kind of spiritual experiences that can further their growth? If they have to know your personal experience, then there's something else that's going on other than that vicarious need to learn, the need to learn vicariously through other people's experience. So sometimes you can judge, like if a patient, as a person is comparing their experience with yours, and if there's a certain narcissism behind it, where they're thinking, is my experience have more wow factor than your experience? How would that affect their relationship with a therapist? Or they might have kind of a self-esteem issue where they will then take your experience and think, my experience is not as good as your experience. I'm not as important. So that transference and countertransference, I think, can still happen regarding these kind of exchanges, regardless of whether you talk about a spiritual experience or whether you talk about your personal, growing up developmental experiences, I think.
Thank you. Thank you so much for your input.
Yeah, great points. And thanks for being with us, Diana.
Oh, you're welcome, Katrina.
All right, take care. Okay, great thoughts. Great thoughts, and something definitely to keep in mind. So talking about professional dilemmas, is there an experience that any of you have had that you would like to share publicly about a professional dilemma you've had with this topic in mind, something that may have come up when working with one of your clients, or thinking about working with a potential client? Anybody have a story that they would like to share with us?
I had thought about it, so maybe a short little story.
Sure.
So before I got into holistic psychiatry, there was a 15-year-old patient who came to see me. And he came because his parents knew that I was of a particular religious persuasion, or I belonged to the church that they belonged to. And they just knew that from, all the interconnections with the organization and stuff. I don't belong to that particular religion anymore, but at the time I did. And they were troubled by their son, number one, because he was depressed at that time, but also he had already, by the age of 15, he already had 2 suicide attempts. One of them was by trying to hang himself in the inpatient unit of a psychiatric hospital. And and the other thing is that when he would go into his intense fits, he had a really intense, dramatic shift in the way he talked. And later, but during the session, my initial intake session with this young 15-year-old adolescent, as he was talking about his history, it was all just very normal, kind of a clinical depression presentation. But then he started talking about religion and spirituality. And he was saying how much he hated God and how much he hated the religion. And as he was talking, I saw a face pop out from his face. It was like if you can imagine like the Wizard of Oz with that shadowy kind of gaunt look of the wizard, that it was like that face, and it just kind of popped out, and I could see the shadowy kind of like look, and it was a very stern, gaunt face. And so it kind of struck me with some intense kind of emotion, and I immediately, like in my mind, I started to pray silently to myself, because it was a very evil kind of experience. And so afterwards I spoke with the parents, because the parents were at home, and it wasn't about the session, but they volunteered to say that they thought that their child, when he was having his fits, was possessed. And so and they said that he spoke in a different kind of voice during that time. I had never had that experience before. I'd never worked with a patient like that. And so after I spoke with the parents, and I spoke with a young man, I did have this question in my mind: am I the right doctor to be helping this young man because of my lack of experience? And so I kind of, in my mind, I had this little internal conversation with God, and I said, you know, I don't really feel comfortable working with him because I don't know what it's like. I'm not an exorcist, you know, I don't work with possessed people. But then what happened was that there was a very peaceful feeling that came into my heart, and I felt comforted. And so I decided to go forward and work with this young man. It turned out to be a pretty easy, kind of straightforward depression kind of treatment for a while. And then I had this experience one day when I was playing cards with him and having our therapy kind of over cards. He started talking about how much he hated God and how much he hated religion again. And his voice did change. It became this raspy kind of dead voice. And he said that he allowed 3 negative spirits to possess him. He actually knew that they were there. And he told me that he had basically allowed them to be there in that session at that moment. And I could feel the back of the hair, well, my hair on the back of my neck stand up. I actually have never felt that before. If you've ever felt the hair on the back of your neck stand up, that's a very strange sensation, but my hair stood up. I felt their thoughts in my mind. It was a very overpowering kind of sense of fear. I knew that they wanted to destroy me. They wanted me to be filled with fear, and they wanted to control me. And these were 3 clear, very strong intentions on their part. And so, of course, I started to pray internally again, very fervently. Outwardly, I was still trying to keep my little, like, you know, psychotherapy demeanor, like I was like pretending like nothing was happening. And then I had this experience where a beautiful golden light seemed to be coming into me and surrounding me. So if you can think of possession as I was possessed by this beautiful light, and he was possessed by this kind of a awful, horrifying kind of trinity of negative spirits, that was kind of how I felt was happening. And immediately, all of that fear and the ability for their thoughts to telepathically enter my mind ceased. And we had an interesting conversation where he would explain certain things that he hated about God. And I found myself responding back in a very spiritual, kind of almost like divinely inspired way. An example would be like he said he felt that God was too controlling, and that God just wanted to be worshipped and to be controlling of his life. And I went into this explanation of freedom and free agency I never even thought of before, where I said, you know, freedom is an opportunity or a tool for us to grow in this life, and we're given as much freedom as it's safe to have. And I said, for example, you wouldn't give a baby a chainsaw. You would want to give them, you know, blocks or things to play with. Also, if you went into a shoe store, you wouldn't, you know, you'd have sandals and hiking boots, but you wouldn't have moon boots there because you're not going to the moon anytime soon. And so I found myself saying those examples, and those examples actually stuck in my mind, and my memory's not that good. So I know that there was something about that response and the way it kind of entered my mind that was otherworldly. And I learned at the same time that he was learning, and it was all a very beautiful experience. And this kind of went on for about half an hour, and afterwards he had this look on his face of pure disgust, like, I'm not getting Dr. Lee to be scared. She's just giving me all this information that I don't want to hear, and this is really a waste of our time. And so as soon as that look entered his face, they left, and he was back to him into his like 15-year-old body without all of that negative energy there. So we kind of concluded the session soon after that. And that was the last session I had with him, because events unfolded where he had a fight with his parents. He tried to kill himself by putting a paper bag over his head. His parents didn't call me until like a week later about that event. And when I was speaking with the parents, they were offended that I asked them to, in the future, tell me right away, things like that when they happen. And they also said that their mother, his grandmother, also had chronic suicidal tendencies. So I think it's a multi-generational issue. It's a very profound kind of spiritual issue. And it taught me a lot. It was more for my growth, I think, than for his.
Wow. That's beautiful. Thank you so much for sharing that. It's such rich and complex stories happening within this framework of someone coming to you, not just in what you're experiencing in that moment, but then the dynamics of how do I share this and do I share this? And just in general, when you're working with an adolescent and trying to disclose to the parents and knowing the boundaries there, and then whatever their religious persuasion is versus what you might be experiencing and how they might perceive that.
Yeah, I noticed that at the time that I was talking with him, that I didn't disclose that I had this spiritual experience. I just simply gave him the answers that he needed to hear.
Yeah. Great. Thanks for sharing with us, Dr. Lee. Does anybody want to maybe respond to that or have a story that they would like to share personally, similar along the lines of professional dilemma you've experienced?
I'd be glad to speak up.
Yeah.
So early on in my career, I had an interest in learning to do past life therapy because I was always interested and fascinated in reincarnation theory, and had already taken some courses in hypnosis. And I was actually presenting at a conference, this could be about 30 years ago, wasn't quite yet trained, but I had an experience which gave me a sense of the need to hold on to good, sound, professional assessment, the need for assessment as to who we would work with in doing any kind of regressive hypnosis approach. So at this conference, we were staying overnight. It was for a weekend, and it was here in Charlottesville. And somebody just allowed themselves to be worked with somebody who I believe was not trained as a therapist, and who, however, had learned some of the techniques of doing past life therapy. And this individual was regressed and traveled into a time when she was experiencing being in the throes of a body that wasn't functioning well. How it came to my attention was I was walking outside and I heard a curdling scream coming from the conference room. And people, when I walked in, I saw this woman all contorted, and people were saying, what's going on with her? And they said somebody was just working with her, and she got really, she started looking like she was in some form of paralysis and wanting to throw off this experience, saying, no, I'm not this person. No, I'm not this person. It was really, really decompensating very badly. And people looked to me because there weren't a lot of other clinicians there, and I was on the panel. So somehow or other, I was granted this, you need to step in here and help us. And I took her outside and tried to orient her. And I'll be honest with you, it was quite frightening to enter into that situation and realize that this woman had, I guess, naively allowed herself to put herself in the hands of this individual who not only was not able to help her, but left her in the throes of the crisis and just disappeared. Nobody knew where this person went. So for me, the dilemma there was, one, I was still a little bit cautious about coming out. I didn't want to get marginalized in my own community, as I had only been in the area for 5 years, even though I was super fascinated by a lot of the topics we were talking about. But after that, I took some training in a number of different approaches. One is I trained for a couple of years with Roger Woolger as a past life therapist. And it leads me to always want to keep in mind that we're always working with people who have exceptional or supernormal experiences, but we still need to keep ourselves grounded in knowing, like, who can tolerate, working in certain ways. Like, I wouldn't just have somebody, I don't hang a shingle as a past life therapist, although if I feel like I've worked with somebody and have done a considerable amount of discovery and looking around their life and trying to understand what in this present life might contribute to some of the problems they're having, I'm willing to do some regression and follow where they go. And it's been very productive for individuals. But I wouldn't just let somebody walk in the door and just start doing regression with them right off the bat, because I see that if I don't have the opportunity to do a fair assessment of how grounded they are, I could lead to something where you don't know what you're going to find when you start trying to get behind people's defenses. They might not have the structure to be able to handle what comes forth, and you don't have the established relationship. So that was an interesting experience for me, because I didn't want to throw the baby out with the bathwater. I see the benefit of doing these kinds of alternative approaches, but I think we need to keep one foot solidly grounded in what we know about how the psyche works, and also be willing to expand the boundaries a little bit to be willing to open up to other alternative means of accessing growth and different experiences.
Beautiful. Yeah, I really love that, and the way you put that, keeping ourselves grounded in the theory and the research that we understand about psychology, and also being open to the spiritual realm and how our personal experiences influence that. Just really is just expanding the range that we can offer to our clients. Great, thank you.
I completely agree with Frank, and thank you for saying that. It so often people get trained in past life regression, and they really move through it in a haphazard way, and they don't really respect or honor the role of the psyche in this process. And if you really look at Roger Woolger, who I also trained with, and Brian Weiss, when they have done past lives, regressions, they've been working with these clients for 6 months, a year before they even start to do this. So I really wanted to kind of comment on that, and also to share just a really quick story, because I had something recently happen that was, again, a kind of an out of my experience and when I see people on a once a week basis, I'm really not communicating with them, from week to week. But there was a gentleman who came in, and he was in his mid-60s. The minute I saw him, I knew something was physically wrong with him, and he was really resistant about going to the doctor. And there were no signs. It's not like, he didn't look pale. He was walking well. His focus was good, but there was just something, and I kept thinking about it. I couldn't let it go. I was dreaming about it. I was having dark dreams. I was seeing him in a casket. I mean, I was just having these premonitionary dreams that were racking me, so much so that I called him. I said, listen, I know this is going to sound strange, but there's just something that is concerning. And I said something about dry mouth, and that your mouth seems dry in session, and sometimes that's a sign of other things. And would you just mind going to see your doctor? And he was resistant. And then the next time I saw him, would you please go see your doctor? I texted him, would you please go see your doctor? It was like I went into another world, and I don't do this. I am boundary specific. I have my feet well grounded in this earth, and there is no way that I will kind of go out on a limb like that. And finally he went to the doctor, and the doctor said, had he not gone there, he would have died. And it was so powerful He came in because he was hospitalized. He came in, he had a blood disorder that they would not have known about because it's very hidden, like sometimes a leukemia can be hidden. And he actually needed blood transfusions, and it is something where he really needs to not be in New York anymore. He needs to be in warm weather. And like he came in a month and a half later after many hospitalizations and said, "You saved my life, and I don't know why I even listened." And I said, "I don't know why I listened either." And you know, and it was so unlike me. I talked to my husband about it. I talked to friends, because I knew that there was nothing that I was drawing upon that had any real clear data. And I kind of have this belief that unless I have 3 points of data, I don't make a move. But here I was making all of these moves, and I ultimately trusted myself. And so I guess to the clinicians who might be listening, trust yourselves, and to the folks who are out there, trust yourselves. Even if it seems like it's an out-of-body experience or you feel like you're losing your mind, maybe you're not. Calm yourself down and listen. And you might be surprised what is getting communicated to you, what images come up, and trust them.
Beautiful. So important to underscore that our intuition is always there, and especially I like that kind of rule of 3 times, and you have to do something with it. Well, thank you so much, Edie. Let's bring Elizabeth back to ask a question.
Could I just say
Hi. Oh, yes, Alice, go ahead.
The thought that came to me when Edie was talking was how much love the universe has for each individual, that they knew that Edie would be at least open and be able to receive the message. And so the universe kept working with her so that she could be that beautiful channel to save this man's life. And I just felt like that channel where the influence that was working with her was just so full of love for this man that it was just working really, really hard with Edie. And she was, she was kind of like, well, what's happening here? But it's really a manifestation of love from the universe, the spiritual world, for one specific person.
Thank you, and you're right. And even as you were, sharing these thoughts, I'm emotional about this, and I think sometimes people think, oh, well, we're therapists and we don't get emotional necessarily because, but the emotions, we cried together in my office, and as you just shared that, it was divine. There was something so divine and so pure. And, he didn't stay in therapy that long, but he actually came for what he was supposed to be here for, even though that's not what it looked like. And so often we think that, oh, well, this is it. This is the diagnosis. And what I've learned is to get away from the diagnosis, to get away from that chatter, and to listen to the undercurrents, because they are so much louder than any diagnostic book or theory, can give us. So thank you. Yeah.
Wow. I'm in tears myself. I'm holding back tears because this is exactly, this conversation today is so near and dear to my heart. I work for Assist as the president, but I also am the trainer for the peer support group facilitator training. And as that trainer, I've talked to many, many people who have had their experiences pathologized with someone who hasn't been able to be with and bring the presence that the 3 of you have brought to your clients. And your presence is exceptionally beautiful. And thank you, Dr. Lee, for reiterating what was really happening, this love that is being channeled through all of you beautiful professionals and all of those that are listening to this, that would take the time to attend this type of webinar. The question that I have for our panel today is this: the dilemma of being a spiritual experiencer and a mental health professional. You have a greater sensitivity perhaps than maybe those that don't. One of the complaints that I have heard of from our facilitator trainees is that they go into therapy or into hospitalization, and the mental health professional is the expert, and their meaning is no longer valid. The patient or the client's meaning is no longer valid. So the dilemma, how do you work with someone and still be the mental health authority and make room for the client's own meaning so they can begin to integrate this differently?
I'll be glad to take a stab at that. I think first it's to hold a non-judgmental position and be unconditionally accepting and with the person. And I do think that there's a certain, it's a doubly difficult challenge, I believe, to try to say, I personally believe and have had experiences of an anomalous nature, so I know firsthand that they are difficult to try to categorize or put a handle on through the usual psychological jargon or the ways in which we conceive of how the mind works. It requires expanding our conception of mind and consciousness and how spirit is interacting. So what I would feel with this, with a person is that once it has been established that they seem to be grounded and that they had this exceptional experience, that the meaning is to come from them. I mean, if they're trying to understand how can it be that the mind or spirit works in this manner, I'd be inclined to say, well, share what I have come to understand, but encourage a search, encourage some reading. And the idea that they will take their experience and try to arrive at some meaningful understanding of it. I think it's sort of like working with something as common as a synchronicity. I mean, you can have a coincidence and somebody feels like, wow, the fact that these things came together in time, and the Taoists would say, why is it that these two things come together at the same time? The person, I think the meaningfulness is going to be derived. That's what makes it a synchronicity, is that it's the meaning the person derives from it. And I don't think it's ours to give, although we can think along with them. So I often want to honor the fact that, just like I would work with a dream, somebody would bring in a dream, my first questions are, what do you think it means? What do these symbols mean? What do they bring into your awareness? What is your higher self trying to bring to your awareness? Before I would assume that I have the answer for that. So I think the meaningfulness is pretty significant, and I think we're trying to draw it out of the individual.
Thank you. I love that. Dr. Lee, did you want to respond to that?
Yeah, the question, I guess, is how do we as clinicians honor a person's spiritual perspective on things in light of all of the other things that might be relevant in terms of their healing process? And I think one of the things I learned from going to Assist is I have an initial intake form on my website that people fill out. And after I went to Assist, I added a section on my initial intake form on spiritual experiences, so that when people are filling out the initial intake form, there's actually a section that asks about, have you had near-death experiences? Have you had out-of-body experiences? Or whatever it is, what is your relationship with you know, in terms of your feelings about God and things like that. And I think that that kind of opens an opportunity to feel that that's something that's relevant to me as a clinician when I see them. Also on my website, it's very clear when I talk about holistic psychiatry, I look at 5 fields. So it's spiritual, mental, emotional, physical, and social. And so spiritual isn't just taken out but is inclusive and it's part of the whole. And I think the other thing that allows, I think, people to feel affirmed in terms of being able to at least tap into that area and talk about it is that I try in my practice to show my patients that there is a connection between the physical health, which is what they're coming in for, to come off their meds, and their mental mindset, by showing them through muscle testing that if their thoughts shift from one state to another, that it affects their strength, their muscle resilience. And also when we use these tapping methods, whether it's just tapping like EFT, or it could be just intention through logosynthesis, that when you are able to shift energy through your mind and through your intentions, that your physical body actually shifts and changes in terms of that specific problem. So patients in my practice start to learn that just because it's invisible and just because it vibrates at a place where you can't see it with your eyes does not mean that it can't have a profound and immediate effect on the physical health of the body. And so as we kind of develop in terms of our ability to try to help them heal, they become more comfortable integrating what is invisible into what they think of as physical healing.
That's incredible. Edie, how do you manage being somebody's mental health authority and giving them space for meaning?
You know, when people walk into my office, one of the first things I say is, this is a very crowded room. And, and we've got aunts and uncles, and we've also got, you know, what you imagine and your experiences and your outside experiences, your internal experiences, your spiritual experiences. And we're going to have a conversation with all of them. And what that does is it actually, it levels out the playing field. It lets them know that all are invited into this discussion. So often what happens, you know, you called me mental health authority, and I actually don't think of myself as a mental health authority. I actually think that they're the mental health authorities, and they're giving me insight into how I'm going to help them heal. And through their dreams, through their spiritual experiences, we work in tandem. And yes, do I have understanding and knowledge? I sure do. But I almost think of them, and I know this is going to seem like an odd, you know, metaphor, but they're Dorothy with the red shoes. They have the power. They've always had the power. They walk with that power. But what do you do with the power? And so often the mental health issues are actually made bigger and broader because of the fear that happens when they are an experiencer, when they have, you know, come back from a near-death experience. And the fear or the anger of being back is tantamount to committing emotional suicide. So it's about helping them to find that playing field, that emotional playing field, dealing with their anxiety, not being afraid to share their experiences, and finding the right paths for those experiences. And then we both become experts in healing. And oftentimes the mental health issues quiet considerably when the other parts of them are allowed to be alive, have a place to land, and be nurtured and seen. And so that is the balance.
Wow, absolutely beautiful. I'm so excited. I want to thank all of our panelists today. We're so excited that all of you are here to support, assist, and share your wisdom and guidance with everyone at Assist and everyone that's watching today. We're going to move into the public Q&A part. We've had some people that have attended today that have asked some questions, and I apologize in advance because we're not going to be able to get to them all. So I'm going to choose the ones that are most relevant to this specific topic today. And for those that we can't get to, we will answer them in future conversations. So stay tuned. Katrina will be talking to you about that before we sign off today. The first question is from Linda, who asked, how would you handle self-disclosure with clients about personal experiences if you work in an agency setting where there is stigma and judgment about this topic? Who'd like to start that conversation?
I would be glad to speak to that because I worked with a very conservative organization for many years, and I knew that there were entrenched in a set of beliefs that made no room for the exceptional and anomalous and the supernormal capacities that we have. And so I tended to be very discreet. I think I would sometimes preface what I might say. I mean, to my client to say, I'm trusting that I have your confidence like you're trusting I'm holding yours. And I don't mind sharing this with you. But I think part of that could be a lesson about, recognizing how to be prudent and how to determine who is receptive to your message. I mean, I think there's an element of recognizing that there's going to be people who have never had an anomalous or exceptional experience of any sort, and it could be miles away to try to just get your head around, what it's like to have a near-death experience or a precognition or a telepathic dream or an out-of-body experience. So I think there's a certain element of learning there where you would say, you might want to say, I'm going to honor this relationship and trust that we can keep this here with us. I don't think I'm binding them by doing that, but I think I'm teaching a lesson, saying I want to be open with you because I think if I can share an experience that may validate, although I agree with what Edie said earlier about milking that from them first before I start putting all my experiences out there, only in the way that I would in normal and under more conventional kinds of problems. But I do think you need to be discreet. I think you need to be real that, if somebody's talking about a past life experience, we know the statistics are only 24% of the population believe in reincarnation. So if you're working in a very conservative organization, people have a tendency to sometimes demonize these kinds of things. And so I would walk wisely in what I share and how I would work with people.
Could I say something also? I think that there's a difference between stigma between the clinician and the organization, and the stigma that can happen between a clinician and their patient. So I think the question has to do with working within an organization where if you did something out of the norm, that stigma from the organization and how it will affect you. And I think that there's a couple of thoughts. Number one is, how will it affect you? Are you going to lose your job? Because if you're going to lose your job, then, you need to be very conscientious of that and respect that. If it is simply that if you are being authentic and you want to start exploring things that you're interested in, and you will experience stigma, but you're not going to lose your job, they can't fire you, you're having a great, experience with your patients and their, clients because of it. My thought about that is that stigma is just like any other kind of experience with bullying or in a social setting, that you got to have the ability to understand that that's their issue. If they want to think of you in a certain way, that's their issue. And you have to deal with how your reaction to the stigma is going to affect your authenticity. I choose to be in my own private practice because, it's more comfortable with me to do that. But I certainly experience stigma, even in my kind of bubble, in my own private, solo private practice. I've had experience with stigma because as a holistic psychiatrist, had to deal with the Maryland board. And literally, I was at risk of losing my license because I was holistic. And the response to that was that I had to hire attorneys, and we did set a legal precedent in Maryland, so that holistic practitioners could practice more freely, because at the time that I was practicing, there was much more stigma. But I think that if you think of yourself as someone who is placed in that position or role because you are meant to further and progress that organization as, in some ways, a quiet leader or setting a positive role model or example, rather than thinking of it as they're going to stigmatize me and therefore I can't speak what my truth, or I can't keep learning an area that I feel is dear to my heart, then that's more of a thing that I think we should work on, and just turn it around and look at it from a perspective of that it's an opportunity for you to help other people to shift their energies in a way. Because if it works, if what you do helps clients and you have lots of clients and they're getting healthier faster, then that's what really matters, is that the fruit of the tree is really beautiful, rather than how would other people look at the fruit of my tree.
Wow, Dr. Lee, thank you for having the courage to hire attorneys and fight for your right to practice as you have been guided and to practice from your heart. That's so beautiful. Thank you for your courage.
I think, yeah, not by choice for sure.
Right. So frequently, right, when we do this work, it's always, we get confronted with, if I had my preference, I wouldn't be in this position. But then we get, you know, put in a position where we have to make a choice to be authentic. So thank you for doing that to all of you. Edie, would you like to answer this question as well?
It's such a dilemma, but really what Frank and Alice brought up is the willingness to find a way to honor the work and to honor what you know to be true. And no one can make you disbelieve what you believe. So it's a path, it's a journey of standing up for what you believe in, maybe even having to hire attorneys. Kudos to you, and look at what you opened up. Look at what you opened up for other clinicians. And that is the gift of maybe the grief of having to fight for something that is not the norm, that we're only 24% of the population believes in this. And it doesn't matter if they believe in it or not. And that's a question that people will often ask me, you know, like, well, what if past life regression really doesn't exist? Well, what if past lives don't exist? Well, if the regression helped you, then it doesn't matter. And so if you take someone's past life or their experience within a setting that doesn't believe in this, then guess what? You can say, it doesn't really matter what we call it. What matters is we honor it. And then you go with that.
Gorgeous. What a gorgeous answer. Thank you so much. We have about 6 minutes, well, actually about 8 minutes left. So let's ask this question. What authors, videos, or other resources would you recommend to therapists who have clients that are still willing or still trying to integrate, normalize, or make sense of their NDE? What are some good resources that you would refer people to?
I would say the work, well, Ken Ring's work has been around for a long time. I think it's Journey to Omega. That's been out for years. The work of Bruce Grayson here at the University of Virginia. There are quite a few books, I think, that would, if it's just specific to near-death experiences, or is it more general about various kinds of spiritual emergencies? Stan Grof's work would probably be a couple of good places to start.
Thank you. Yeah, the question was specifically for an NDE, but I think, you know, in the context, any spiritual experience resource would be helpful here for our viewers today.
I have recommended the book Dying to Be Me, that book on the NDE, where a woman healed from cancer after her NDE. And I just feel that sometimes just having a patient know that the mind and body is connected, and how love is that bridge between healing and their near-death experience can be sometimes very helpful for a patient to know.
Thank you. Edie, do you have any resources you'd like to share?
I think that Frank and Alice have both, brought in resources that are fantastic, and, go to the ASIST website. There are lots of resources right there. And so that's what I would recommend. That's a really good initial go-to, and, talk to other people.
Thank you, Edie. I was going to mention our assist page, so thank you for doing that for us. Yes, actually, I would highly recommend that you go to www.aciste.org and go to our resource directory page, and you'll find many resources from university research and university programs to books and videos about all different types of spiritually transformative experiences. And there's many different topics that we could talk about specifically, and many different authors that we could talk about. But those on that resource directory page, it'll actually link you to other links and to other resources that will have more resources. So please go through that as well. Katrina, that's it right now for topic-specific questions. And I'd like to turn it over to you to wrap it up here today.
Yes, I think this has been a really valuable conversation. And again, thanks not only to our panelists for coming on to share your expertise, but also to our participants, to everybody watching, whether you're a clinician or an experiencer or someone who is neither but is curious. We really appreciate you being here. And I want to thank you for your questions too. We were trying to keep this conversation really concise to the clinical dilemmas that we face, particularly as therapists. But we are looking to be informed by all of your questions and all your curiosities. So please keep asking them. We'll be hosting these community conversations, I think, quarterly. And we would love to be informed by your questions as to our next topics when we're looking to invite panelists to join us in the future. So please stay tuned into us. We're on Facebook, and our website is aciste.org, ACISTE.org. And of course, our next conversation is going to be live and in person in Chicago at our annual conference, which will be hosted October 4th through 6th. And you can register now for $450 until August 31st. And after that, the late registration goes up to $475 starting September 1st. But there's still plenty of time to take a look, check out all the wonderful speakers we have that are going to be joining us, including, of course, Edie Nathan, who's here with us today. So we really look forward to meeting all of you in person. It's a great community and great presentations and just wonderful energy to be around. So I really encourage you to look into it. And if you feel called, please join us. And of course, there are also discounts available for students and for members of ASIST. And of course, we're a nonprofit. So if you are interested in supporting us through your donations or as a volunteer with your skills, we would really appreciate that. This is a community that we hope to grow. I think there's a big need for this right now out there. And I think the mainstream is just waiting for us to get the message out there. So if you feel called to contribute or work with us in any way, please be in touch, and let's talk and see what we can do together. let's see, anything else? I think that's it for today. So again, thank you so much to our panelists. Thank you, Elizabeth, for having us here today. And we look forward to talking with you all soon.
Thank you for having me.
Thank you. Thank you, Elizabeth. Thank you, Katrina.
All right. Thank you all and have a great day. We'll be in touch.
Yes, thank you.
Thanks.
Okay, bye.
Bye.
Bye-bye, everyone. Have a great day.
You too, Elizabeth. Bye.
Bye-bye.